Hey everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. How's everybody doing? I hope well. Sorry about the delay in the show again this week. I sincerely apologize. We were doing some traveling, visiting some family. You know, we have to share the love with the Tripsies. Again, I've missed talking to you. I hope you've been able to check out my previous shows, and of course, if you have any comments or any suggestions for any topics for shows or anything you would like to hear about, please feel free to comment. And of course, the babies are doing well. We took a little road trip and they had a good time. Everybody survived, including mom and dad. So I'm glad we're all still alive. Again, the Dr. Mom Show here, what I do is I just provide an educational program just as a resource for people and things about health and their children. My show does not take the place of your physician or your child's physician. It's really just for medical information. So if you remember, my previous episode was about depression and it was entitled Depression Kills. Today I'll be talking about Depression Kills Part 2. In my last episode, I discussed what depression is, how we screen for it. Today, I'll be talking about more so treatment options and the next steps if you are diagnosed with depression. Just as a side note, what I talk about today is about what we call unipolar depression, and that is just depression itself. There's several different types of depression, and some other ones include things like bipolar or patients who are depressed and also suffer from manic episodes or mania. And I was just fixing my hair here. It was standing up, you know. At least I can see, so nobody has to tell me it's standing up. So again, this is straight unipolar depression. This is depression itself, not with anything like schizophrenia, as I mentioned, bipolar or mania. So after a patient has been screened, or if they have symptoms or they feel like they have symptoms consistent with depression, and if the diagnosis is made, usually a physician will bring up treatment options. Two types of treatment options for depression include medication, and the other one is what we call psychotherapy, which is seeing a counselor, psychologist, psychiatrist. Just to give you the differentiation between all of that, a psychiatrist is a physician. That person went to school, has a medical degree. A psychologist does not have a medical degree. They are not a physician. The same thing is true of a counselor. Some people will get what we call a PhD or a doctorate, and that is not equivalent to an MD, which is a medical degree, MD or DO. So now, when the diagnosis is made, most of the studies that have been done, people usually have a tendency to, of course, show that they do well if they do both medication and therapy. Of course, people are busy and they may not necessarily have time to go to therapy sessions. Other options include just doing medication and then, of course, just doing therapy or counseling. Now, when the choice is made, of course, physicians always leave that up to the patient. However, if you have someone that is not doing well, or you are more concerned about, let's say they have severe depression and it's not necessarily mild depression, that's sometimes where a physician would come in and say, hey, I think, you know, definitely starting medication while you either wait for therapy or things like that. We would recommend that, versus if you have somebody who may just have very mild depression, and if they want to do straight therapy, a physician may be okay with that, to say, okay, let's go ahead and do the counseling. But again, we wouldn't want a patient to be in a situation where there's any symptoms that are life-threatening to themselves or anybody else. So as far as medications, there's several families of medications. I'm sure you've heard of some of these, including Prozac, Paxil, Lexapro, Zoloft, Celexa, Cymbalta. There's other families like bupropion, amitriptyline. So there's many medications out there. Kind of the first line that we use, they're called selective serotonin receptor inhibitor. Sorry, I drew a blank there. And those are probably the most common ones because it has been shown to help rather well that we start off with. A good thing, and this is something that your physician or a psychiatrist may bring up with you, is the question if there's anybody else in the family who suffers from any mood disorders like depression, bipolar, anything like that. Because what we found is if there's a family member who's on a medicine that is helping for the same diagnosis, the possibility of it helping another patient who's related to that person is higher. So genetics does play a role with that. There are some new tests that some psychiatrists do too, that's DNA testing by swabbing your mouth, and that will give a full-blown list of what medications in different families are helpful for what disease processes, which would include things like depression. It depends on your insurance. Sometimes this is covered, sometimes it's not. So that's something that you would want to discuss if you are more interested in that with your physician and possibly your insurance company. Again, as I mentioned, after medication is started, you can also choose therapy or not, or you can do that later, or like I said, or you could do that first without medication. Of course, your physician will speak to you about any possible side effects of these medicines, and if you have any questions about those, I know for me a lot of patients will say, well, you know, my friend or my family member was on this medicine and X, Y, and Z happened. So that is something, just let your physician know what all your concerns are. Normally you can feel if the medication's working or not within about 2 weeks. Sometimes some of these medicines can even take up to 6 to 8 weeks to really feel a full effect. So really, as a physician, we don't say that you failed a medicine if you probably haven't taken it, and of course this is without having any side effects, for about 8 to 12 weeks. With that being said, the next step would be that we would probably increase the dose of the medicine or go ahead and switch you to another medicine, again, just depending on what the case is. Because normally we start you on a lower dose of the medicine instead of a high dose, because as doses go higher in medicine, there's always a higher potential of possible side effects. Once you're on medicine, kind of depending on how the depression's going, some people, and again, the severity of it, some people will take medicine for about a year and then do a trial off of the medicine to see how they do. And again, this is something that needs to be discussed with your physician, psychiatrist, counselor, because you can't, with most of the medicines, what we say, just cold turkey stop them. A lot of times you need to taper the doses or slowly decrease the dose in order to come off of it. And once again, I just want to remind you that depression kills. Last week we talked about suicide a little. Again, I just want to reiterate that there are hotlines out there that can help for anyone who has any thoughts of hurting themselves or anybody else. Please seek help if you feel like you do need help. And also just a reminder, as a provider, as a physician, and even counselors out there, we all take an oath to help patients, and even if you just need to bring it up with somebody, or again, as I brought up, one of the treatment plans is seeing a counselor, and some people just feel more comfortable speaking with someone who they're not related to or somebody they don't see every day, and sometimes that in itself helps if you're able to just talk about everything. Well, again, I hope you enjoyed this week's video. And if you missed part 1 of this, check that episode out, which tells you a little bit about depression and what it all entails. I hope you enjoyed this episode talking a little bit about the treatment. And of course, again, don't forget to make any comments or suggestions if you want me to talk about a specific topic. Have a great week. And sorry, the triplets are napping right now. This is how I get to tape. So, but I'll make sure I get my Tripsy clip up of them. And thank you again for watching the Dr. Mom Show. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. All right, take care. Bye-bye.